Hello, everyone. Thank you for joining today. My name is Cynthia Klein, and I serve as the Project Director for the Take Heart Initiative. We hope everyone is continuing to stay safe and healthy during these times. We recognize that we may have a few folks who aren't familiar with the Take Heart Initiative, so I just wanted to spend a minute at the beginning here to tell you a little bit about the initiative, and then we'll transition to our speakers for today. We'll have Dr. Stephen Hines, who will be our moderator. And then we'll also be meeting with Dr. Hicham Skali, who you've met in the past, and we are just really happy that he's been able to be with us through these sessions. So those not familiar with the Take Heart Initiative, this is an Agency for Healthcare Research and Quality initiative. It's a dissemination and an implementation project. The goals of the project broadly are to increase knowledge and awareness of cardiac rehab, but then also specifically to increase referral, enrollment, and retention in cardiac rehab through two evidence-based strategies, automatic referral and care coordination. So a lot of our activities are geared towards these two objectives. We have two other goals for the project. That's to inform future efforts to reach underserved populations and reduce disparities, and then also to increase efforts to increase utilization of cardiac rehab within system-level efforts. If you haven't met with us before, you may not know, but a lot of our training materials, our education materials, our TA materials are all geared and based on the Million Hearts AACVPR Cardiac Rehab Change Package. That's kind of the foundation for a lot of the work that we do here. So that's Take Heart broadly. On the next slide, just wanted to make sure we do welcome everybody again to the initiative from Take Heart, from ARC, from CDC. For those who have been meeting with us, you know that we've changed up our activities a little bit here. We work with a cohort of partner hospitals, and please know if you are in that first cohort of partner hospitals that we do plan to reach out to you shortly and get some input, what your thoughts are about resuming training and implementation over the next several months. So please be on the lookout for some information from your coach. Please know that we're also continuing to initiate affinity groups like this one on priority topics. We're also going to look to start a new set of affinity groups that support communities of color coming up as well. Anybody who is interested in joining these affinity groups can join, but we'd like you to go ahead and register as part of the learning community, and there's a link here on the Take Heart website. You can join Take Heart. It shows you how to join as a partner hospital or as a learning community hospital. And then also want to just put in a reminder that we have a coronavirus, a COVID page on the Take Heart website that has some additional resources. You can get to it through this link. If you're not able to jot this link down, know that when you go to the Take Heart website on the second banner, you can click to get to this link, and we have some additional resources there. I think on the next slide, we just show you a little bit about the resource page. So this is the COVID-19 resource page. So as I mentioned before, we should have a great discussion today. I'm going to pass it over to Dr. Stephen Hines to kick us off. Thanks.
All right, thanks very much, and welcome to our event from all of us here. We're excited to share some resources that are from hospitals and programs like yours, and we want to encourage you to be ready to share your insights and things that you're doing and materials that you may be creating or using as well. We want to stress that these affinity groups are not exclusively about you listening to people that are experts in the field, although we certainly feature people that have remarkable credentials and experience. But we want to frame these events as everyone learns from them, everyone shares, and we'll tell you about how you can do that in just a minute, and everyone supports each other, because we understand that it's an important time for people to be really working hard to support each other. And we've really been gratified by the support that we've seen from participants to others responding in the chat, sending in resources, and just really preserving the kind of culture that we really want these groups to have, especially in this time. So today we're going to focus on resources and materials that cardiac rehab programs are using to support patients during the pandemic. Now, many of these may be resources that you've repurposed and were using prior to the pandemic, and some of them may be resources that continue to be very valuable to you and your patients as the pandemic eases, which we hope will be soon, but we have no way of knowing for sure. So that's what we're focused on today, and the format is a moderated discussion, relying pretty heavily on the chat and polling features to dialogue with the participants and allow peer-to-peer sharing. So that's where we're headed today. I want to reintroduce Hicham Skali, the TAKE-R principal investigator and the associate director of the cardiac rehab program at Brigham and Women's Hospital. He's a practicing physician that gets great reviews from his patients, and is a great lead and thought leader for this project as well. So we want to move from introducing him to just let you know how to use the chat function if you haven't used it before. You need to click on that little icon that's noted there, which you should see down at the bottom of your screen. If you don't see it initially, you may have to move your cursor over the screen, and then that set of controls will appear. But it's really important to pick the option of sending your message to all participants, because we want your peers to see what you're saying, but we also want to see what you're saying. And if you pick all attendees, your peers will see it, but we won't. And it'll be a lot easier for us, and we'll be able to respond to more of your questions or comments if we can see them as well. So click that All Participants option and just set it there, and then we will be able to facilitate the sharing. So we're also going to do some polling questions here in just a second. We think there's value in you having a sense for what your peers are doing, and we know that AHRQ and CDC are also quite interested in some of the questions that we're asking about the status of your programs. So let's go to the first question here, and there should be some controls right on the side of your screen. I guess this is an open-ended question about the current status of your CR program. If you can just jot down a couple of words, whether it's completely open or partially open to some people, or you're doing most of your work virtually, but you're continuing to support your patients, or if you just completely closed and you haven't done any activities to support your patients using phone calls or anything else. So if you can just jot that down, and then we'll close that question, Gene. I don't think that we'll wait for the results, and then we'll go to the second question in just a second here. All right, and then we're also very interested in when you think your cardiac rehab program is going to resume some in-person operations. And if it's this month, just jot down May. If you think it'll be June, jot down June. So whatever the month of the year is, just jot that down. And if you don't think it's going to happen anytime, this year, you can just put down not for a long time, and we'll get the gamut of the answers that you're putting in there. On the last call, I think that a number of the programs indicated that they would be resuming at least some on-site operations in either May or June, which was a good sign for us to see, but we obviously know that the pandemic is changing, and the guidance from states and health departments is changing as well. So we're very interested in seeing whichever month you think that you may resume some on-site operations. And then this third question is which are we're interested in materials and resources that you and your facility may be using to support your cardiac rehab patients. And if you can just click the option or options on this question that are the most relevant. So are you using pretty much all resources that you had before the pandemic started? Have you created some additional resources in-house? Or are you leveraging resources that you're getting from other organizations to support your patients? So if you can click one of those options, and then after a second here, Gene, why don't we look at the responses to this question? You've clicked, and make sure after you click your answer, if you hit the submit button, then we'll see. So looks like a majority are using some additional resources that you've created in-house. Some are using additional resources from others, and some are relying mostly on resources that you had to begin with. So we're hopeful that some of the resources that we talk about today will be of interest, and we're also hopeful that some of the resources that you are using that you are finding work well, you'll be able to mention to your peers as well. All right, we want to go to one last question, I believe, and in the chat function, just so that we can see the responses from everyone, and hopefully you have an all participants option there. If you can't find that one, use the one for all attendees, and that way your peers will be able to see your responses. So, and we want to encourage you to use the chat function as much as you can. Yeah, it looks like a number of people are not finding the all attendees option. So if you can't find that one, pick the option for all attendees instead. All right, and then we'll go to the last question that we want to ask if you can just use the chat function to share one resource or material that you have found is very useful for your cardiac rehab patients if you're supporting them using remote connections via the web, via phone calls, but something that you're using now with your patients that you're finding very helpful, and ideally that your patients are finding very helpful as well. All right, so hopefully those things are closing, are coming into the chat, and I think that we can close the polling feature. And I want to just turn now to Dr. Skali, and he can take us into the bulk of our focus for today's meeting.
All right, thank you, Stephen, for this introduction, and thank you, Cynthia, for introducing the Take Heart program. I want to welcome everyone to this second webinar of this series. And I know we have a lot of people who are familiar with Take Heart and other people who are less so. And I think this is a great opportunity for us to share some of the information we have, some of the tricks and strategies we have used in these unprecedented times of the COVID-19 pandemic. And I hope we all come out of this stronger and much more informed and more united as cardiac rehab professionals. Without further ado, I think what the plan we had for today is we're going to go for about orientation materials and what we use. I mean, we're going to follow the path that the patients will go through when they enroll for cardiac rehab. So the orientation materials, what information, and we would give them to guide them through their cardiac rehab process and to record their activities, and as well as some recommendations for their exercise routines at home. And we have 4 people who have graciously accepted to share their experiences and what material they have used. And I'm sure some of you have used the same material and others have used different materials. And so we'd look forward to hear on what you have. So I will be introducing them as we go. Emily Keltner will be our first speaker. In the meantime, as Emily gets ready, I want to again remind you, if you have anything that's relevant to that topic, so orientation materials, for example, that you think would be interesting to others, please share that with us in the chat box. If you need to talk to us, we can actually unmute you at some point and let you share your information with us. I'm glad to say that we have over 120 people with us on the webinar right now, so this is really a great success to have so many people attend at the same time about this great meeting. So Emily is from Parkview Medical Center in Fort Wayne, Indiana. And she will talk to us about the orientation packet that she's using for her patients. Emily?
Yes, hi, good afternoon. So with COVID, we had an immediate challenge with our orientation patients, and they just had this serious event, and they were sent home and told that they were going to start on cardiac rehab, and we had no way of telling them when that would be. We were contacting them, but that we needed to give them information, and we were sending packets of information and mailing them things, and we just really needed to have a way to communicate with them that we know that you've had this event, and we're going to be with you along this way. We're going to eventually get you back into the center-based rehab, but this is our plan for you. We didn't have time to just recreate the wheel, so to speak, so I went and looked at what we had in-house, and I also went to CardioSmart and went through all the resources that they have that apply to what a patient would need at home. And so we had several resources. First and foremost that I put on the front page was coronavirus in your heart. I think that was the most important thing I wanted our patients to see. That was pretty valuable information. How to take your blood pressure, how to choose shoes, what is cardiac rehab. There's a lot of good information out there, so I didn't want to try to recreate something and take the time. We didn't have the time to do that. I needed to get something in their hands. So what I did was I was printing all this up, and I had all this set up and putting them in folders and all that. It was very time-consuming. What I finally realized is I needed to make a nice packet, and I'm fortunate enough to have a great marketing team that was able to very quickly put all this together for me in a nice 3-hole punched packet that I could put into the patient binder. We have a nice heart binder that all our patients get when they get discharged. So now this little packet can go into their binder, and so when they do actually come to cardiac rehab, they can actually take it out and use that for cardiac rehab. But they also have it at home, and they can have their log sheet. So when my staff calls them and asks them, okay, what have you been doing at home? How's your blood pressures? What's your glucose? How's your weight? They can tell them, hey, my weight was up 3 pounds. Okay, tell me about that. What was your glucose? So my staff has been able to say, had been able to catch some what I call saves, patients that were having issues, high blood pressures. Well, then we contacted the nurse and let the nursing staff talk to the patient and get some resolutions for them. One patient was over medicated. One had stroke symptoms. So with them having these log sheets that we had in there, it kind of triggered the patient to start talking to staff and telling them about what was going on, as well as giving them some things to do to log on there and to talk about what they're doing. We also had some things on diet and medication adherence. So it triggers conversation with these patients and also gets them doing things until they can actually get back into the center-based rehab.
Thank you, Emily. That's actually very impressive how a lot of programs were able to basically from day to the next stop all their activities and had to be very creative in figuring out how to contact patients, how to orient them, and how to keep this activity going at home and in a safe manner. So what you first alluded to about the coronavirus and COVID is that it's not because COVID is around that people are not allowed to have heart attacks and strokes. So we should continue to engage our patients to be sensible to symptoms and signs of heart attacks and strokes. And so if they are the slightest concern, they should still call 911 Nowadays, a hospital is probably one of the safest places to be because of all the cleaning precautions that are in place in many, many, many hospitals. And so if anybody needs any kind of medical care, specifically for our purpose, heart attacks and strokes, they should call 911, be reminded to call 911, be reassured that they'll be taken care of, and that hopefully we can improve their outcomes out of a heart attack or a stroke if we take care of them right away and they don't delay their care. So that's very important, and I really applaud you for uploading that to your website, and then really giving them instructions about how to take their blood pressure, how to measure their glucose and so on, and track all of that so that when your interactions are going on, you're able to actually give appropriate advice and monitoring and appropriate counseling for their rehab. So that's really what is so impressive in the way we are practicing our skills nowadays, is how we were able to adapt from face-to-face interactions to this whole telehealth, and using this with any means we have. Some people are using web platforms, some are using with telephone platforms, and some people are using just paper and pencil and monitoring that via phone. So that's really very laudable. I see a lot of activity in the chat box about people talking about the cardiac college resources, and some people other people talking about Channel Health. We have not. Someone asking if we have been using Channel Health, if we have any thoughts. In our program, we haven't. I'm not sure about others. We will move on to the next speaker. But in the meantime, if someone wants to share their experience with about Channel Health, for example, they could raise their hand and we could allow them in. What I'd like, as a segue from the first to the next topic, would like to go about how we provide information to our patients and have them use their activity log, similar to what Emily was presenting. But I want to see what Virginia Morris from the MedStar system in Clinton and St. Mary's Hospital in Leonardtown could share with us. Virginia, I think you are on the line.
Yeah, hi. Thanks so much for the opportunity to share what we have. So very similar to Emily, it was kind of, I think most programs, it was kind of a quick, we have to come up with something very, very quick to get out to our patients. We didn't have a lot of time to reinvent the wheel. So my staff at both centers got together and sort of looked at what resources were already available through AACVPR, the American Heart Association, and then, of course, what we already had in the centers. We felt that it was just really important to stay connected with our patients and find ways for them to be able to stay active and take care of themselves at home. So we sent them some basic, we sent them a packet. So what we did was initially we called all of our existing patients to find out who was interested in participating and receiving the packets and getting a call from us weekly. So we've got about 70 patients, 70 to 80 patients that are doing that right now. And we sent packets that included an activity log, some exercise ideas, which you can see there, just some basic looking at exercises that they could do at home without any special equipment. That would be easy to do, knowing that they probably weren't going to be able to go anywhere. We included a food diary, and then similar to what Emily was talking about, some education materials specific to coronavirus, and also around things like coping and stress management. As we all know, depression is high in a lot of our patients, and so we were really concerned about that now that a lot of them were having to isolate at home and possibly disconnecting from their support networks. That was something that we really wanted to focus on. So that's actually a really important part of our conversations with them when we call them weekly, is making sure they're staying connected with family and friends through whatever means is possible. So my exercise physiologists will call each of the patients each week. They go through their vital logs, what are your vitals like this week? Are there any outliers? Are there any concerns? How's your diet? They have them go through their diet log. They talk about their exercise and activity. They make recommendations for the coming week, and just really provide that support to them. So So it's been really well received. The patients have, for the most part, have really appreciated receiving the information. I think they feel really happy to be connected to us. And in terms of resources, it's probably about 10 to 15 minutes a call. And so we've got people staffed Monday, Wednesday, and Friday making those calls and following up with each of those patients. And that's it.
Thank you. That's very helpful and pretty comprehensive. You went through about a lot of things. So I appreciate how you showed us the AHA's recommendation about exercise and stress, but also your the food and diary, which actually comes pretty handy in keeping people to recollect what they've been eating and drinking to help make appropriate recommendations. So you're right. I mean, you go into talking to patients on a regular basis. They're extremely happy about that, extremely satisfied, and it keeps that level of engagement to levels that are extremely appreciated. So thank you. And then about the same topic, Wendy Johnson from Innova Loudoun Hospital in Leesburg, Virginia. I think you're up next, and you could tell us what you've been doing on your end about tele-rehab exercises.
So similar to the other ladies, we kind of put everything together fairly quickly once we shut down on March 18th. Many of the materials that we had in place, we were able to utilize with our patients, and we discussed as a group how could we best benefit those. So similar to the other two presenters, we reached out to our current patients to see who would want to engage and how they would want to engage, whether it would be telephone, email only, or a combination of audio and video, and documented that in each of their charts so we knew exactly how to contact them. Each of our clinicians, we had exercise physiologists and nurses, develop a schedule. We're calling patients throughout the week, Monday through Friday, with a once-a-week touch point, and they're able to utilize, continue to utilize, I would say, the ITP that had been developed prior to us closing in order to create a plan for education each week. Our team quickly put together folders for each risk factor and resources from CardioSmart, from AHA, and from, as you see here, some documents that our exercise physiologist has put together. And based on the assessment of risk factor education need, the items in each folder would be then sent out after the weekly phone call, where we're, again, are assessing vitals, heart rate, blood pressure, glucose, and any other needs on a regular basis. We talk a lot about MET level in our program, and that's how we prescribe exercise. So we wanted to get this education out to them so they could not only understand MET level from what they were doing prior, but how that relates to their daily activity and what that means in what they're actually doing outside of the facility, with some goals to attain there. And we are very fortunate enough that our system dietitian, who was also reduced in her hours because she was not seeing inpatients, was able to work with us to be able to see our patients virtually as well. So we're sending her their recommendations and their food logs. She's communicating with them and setting up hour-long evaluations with follow-ups in order to be able to help them. Our patients have had wonderful feedback, and our staff as well has enjoyed the more independent and individualized education they've been able to provide the patients, and have found that the patients are learning a lot more, asking a lot more questions as they develop really in-depth relationships with our clinicians, where we really try to individualize care when they're in the facility, but by having this video chat, they're really developing some nice relationships, and more in-depth personal specific questions are being developed out of those conversations, and really good learnings happening that we're finding.
Great. Yeah, no, I appreciate you talking about metabolic equivalence as a marker of how hard they exercise, and adjusting that to their levels, especially when you're not able to monitor them in a face-to-face exercise session in your rehab center. So you have to be able to keep it to a common language that you both can understand as a practitioner and patient. So that's very clever. And then I know you had shared another slide here about your thoughts about reopening. I know we have whole session that's going to be dedicated to this in about 3 weeks, I believe, and we'll be addressing a lot of these equipment. So I'm glad to see you're already putting a lot of thoughts onto this. I know a lot of people on the chat box are already giving a lot of information about that. Let me just say that the masking question keeps coming, and at this point, it is, at least in Massachusetts, it is a state mandate. It is also a hospital mandate, and so we will be using that as much as we can. I know we'll have to adjust based on the patient's preference and so on, but we'll talk more deeply about that at our next session about different options and what to do about this and other topics regarding cleaning and scheduling and class size and so on, and following infection control policies. So thank you for sharing your experience with us here. And Steve, is there anything in the chat box regarding activities and logs so far that you would like to share with the rest of the attendees?
No, but perhaps we could redirect the question back to any of our panelists, and that would be, in addition to the resources that they're currently working with and using, are there things on their wish lists of resources that they wish they had or that they're looking for that they would be that they would like to have to complement the things that they had? So if we're able to pose that question to Wendy or Melissa, or if people have responses to that in the chat, we'd be very interested in seeing those as well.
Yeah, that's a good thought, actually. Anything on your wish list that you wish you had or would like to have or planning on having for this remote contacts with our patients? I know some programs have been using Zoom classes, for example, either one-to-one or one-on-one or as a group with only the exercise physiologist on the camera and then other patients just following them. I know some other programs have been using video education on YouTube channels and so on, also either directly from their program or borrowing that from other institutions such as the Heart College, the Cardiac College. So how about you guys? What are you doing in terms of your education for a large number of patients? And what specific topics from our past speakers? Wendy, Virginia, or Emily?
Hi, it's Virginia. So
Hi.
I know the AACVPR has some short education videos, and there's a couple of education videos, and I've forgotten the name of the healthcare system, but I can send that to you guys later to share with the group. But there are some videos that we are sharing, like we'll send the links to patients, so we'll email them with a link to education. It's hard. Some of our patients, the older patients, aren't as tech savvy, so we haven't gone down the Zoom path with them, but we have been looking at videos to send them that are short that they can watch.
This is Wendy. We started using some of the Henry Ford videos, and then our clinicians, or especially our exercise physiologists, they felt they could do some videos themselves since the patients were familiar with them. So we did put together some YouTube 5-minute videos on various exercises. And for the individuals that really needed some extra help, some of the older individuals, we were able to get them to understand how to use Zoom and do almost like a personal training course with hand in hand with them to demonstrate how to use properly. So that's how we're working with some of the different technology.
Nice, very nice. Yeah, no, I've been really impressed and admiring how people have been creative and like really switch. I mean, it's similar to the teachers in schools who were able to do that with a lot of our kids. And so doing it in the same way, the way you've done it with either YouTube, Zoom, Teams, or any other platform is really impressive and admirable how you've done it. So thank you. So and this may be a question that a lot of people might ask, actually, or at least thinking about. I'm going to ask it out loud. have you been billing or paying or getting funds from your hospitals or anything in that regard? Or I know that you cannot bill actually or charge for these sessions, obviously, because CMS does not allow to bill for cardiac rehab charges if you're not actually seeing the patient, you don't have the condition that they have. So how have you guys been coping with that?
Like you said, we have not been able to charge. Our leadership here locally has been supportive of the program from a patient standpoint. I know not all hospitals have had that opportunity, but we've been fortunate enough to continue to have that support. And us now looking at returning to operations, they are starting to see kind of the end in sight so that we can start back to some revenue generation. The way we proposed it was that if we were able to continue to communicate with our patients along the way, then we would have an easier time bringing those individuals back into the program versus not having communication for what's now been about 8 weeks.
Yeah, it's the same thing I've been hearing across different sites across the country, actually. And yes, you're absolutely right. We have to keep the engagements with patients for as long as possible so that we're able to bring them back safely and quickly when we're able to, and then we can resume our charges. It is something that the hospitals, some of the hospitals and systems have been able to maintain support for these programs. I know, unfortunately, some programs have not been able to maintain this, but hopefully we will get back to some kind of normal activity pretty soon. Very nice. I know our next topic is about home exercise resources, and Melissa Heineman from University of Louisville, U of L, Health Jewish Hospital in Louisville, Kentucky, is going to be discussing her experience with this. In the meantime, I know we have put the Henry Ford website link on the chat box. That's been fairly popular as well. So, Melinda, it's all you. Thank you for being with us.
Sure, thank you. So similarly to what's been said, there was kind of a quick turnaround when we realized that we may need to shut our doors due to this pandemic, so we didn't really have a lot of time to plan. So our last day that we had with our patients, or as soon as we knew that they were evaluating our service line, we did switch our education class for that day and made sure to do an at-home exercise class for the patients. We also provided some resources that we had done already. So we reviewed exercise safety options for at-home exercise. We even provided a handout for do-it-yourself exercise equipment, like putting rice in socks or water bottles or using jugs of milk, that sort of thing, some tools that they could keep to help them stay fit at home.
Nice.
We also had some different handouts for people with different restrictions or limitations. So our exercise physiologist had made some different workouts. So there was like a seated workout, so just options for doing the seated exercise program, as well as standing, a drill for people that have weights at home, that sort of thing. So they just had some options. So this information really just reinforced what we've previously taught our patients. And we also re-educated them about exertion, signs and symptoms of when they need to stop exercise or rest, and tips on just if they weren't exercising at home, like a typical exercise, just being more active. So similarly to what other programs have done, we also incorporated that weekly phone call to each patient. So that's when we checked in on their exercise, asked them if they needed any help adjusting their exercise or increasing that exercise. And we also did a weekly group education class. So what we did on that class was we would do the 3 educations we would typically have addressed during their weekly visits, and we did that in one phone call. And we also offered some support to our patients. Our licensed clinical social worker and registered dietitian also called and checked in on our patients and kept their regularly scheduled appointments that we had already made for those patients.
Nice.
So that was nice. So we feel like just keeping in touch and using the phone call as a resource really helped us retain our patients. And we were actually able to open up this week at a limited capacity, and we were able to retain the majority of our patients. And a lot of patients, we found that our interaction with them, for some of them, was the only real socialization they were getting. So that was really beneficial to our patients. And we talked about resources we wish we could have provided to our patients. One thing which we've done in the past, we just didn't have it at this time, but we have in the past provided our patients like resistance bands for them to use like at graduation. So that would have been nice to give our patients a tool that they could use at home.
That's a very good idea, actually. And instead of giving it to them when they graduate in this setting, you would give it to them before actually they start at the time they start in the rehab program or when the lockdown starts, actually. So that would be it's a very thoughtful and very generous gesture. And so I want to acknowledge also, and I've seen that in the chat box, that beyond the programs that have been closed or furloughed because of lack of means, a lot of programs have not been able to actually maintain contact with patients simply because of redeployment of staffing into different activities and different parts of the hospital. And so not everyone has been able to maintain that engagement and contact with their patients. But when you are able to, Melinda, thank you for sharing this. It is very comforting to say that when you are able to maintain that engagement, patients are willing to come back right away and get back to their rehab classes. So that's very comforting. Hopefully, the programs that have not been able to do that will see at least some similar success, or at least a portion of their patients come back. As you said, a lot of these patients have not been engaged and have not been out of where they are, and so this will be their opportunity to get back into some kind of social contacting and back into exercise and be monitored in the medical setting. Thank you for sharing this. Again, this is the Henry Ford link. It is shared in the chat box, and I want to open it up for our attendees and panelists. If you have anything to add in terms of what you've been using and how resourceful and creative you've been, it is just admirable. And so if there's anything else that you haven't heard that you'd like to share, please let us know.
This is Emily. We got a license for MedBridge, which is typically used by physical therapists. And but we've been emailing the resistance bands to all our participants. And so, different exercises just to kind of change things up for the participants, and they can talk them through it. We can show them videos. We've been giving them websites that they can look to, different resources. We've sent them things on, we have Epic, so through MyChart, we're able to send them links to things. So that's another tool that we've used as well. But we've mailed our patients quite a few things in the mail. But I had all the resistance bands at my house and was mailing them out to patients and things like that. So that's worked well.
Yeah, I'm sure. Thank you.
Mm-hmm.
And Hicham, could I ask a follow-up question to all of our presenters here today? And that is, there's a fair amount being written about substance abuse and mental health issues, just being a significant issue for the general population during the pandemic as people's routines have been dramatically changed. So are you doing anything with resources to address those issues? Are you getting requests for those sorts of resources? Are you hearing from the people in your programs that are talking to the patients that those issues are coming up? Can you just say anything that you're doing in those two areas or resources that you're using to address that?
Sure. This is Wendy from Inova Loudoun. With our patients that were with us prior to closure, we have been doing the PHQ-9 and GAD-7, so we were aware and had identified individuals in need. And per our current workflow, we continue to refer them to our behavioral health team that is associated with our hospital system. They have the ability to do video chats and had enhanced that once the telehealth codes got released. For our new patients, we were not comfortable sending out the PHQ-9 and GAD-7 because we were not on site with them to go review. But as we're talking through their weekly assessment, we're asking them how they're feeling, how they're doing, and if they reach out and express a concern, we will then place a behavioral health referral on those individuals and contact behavioral health directly so that they can put them on a hierarchy to be contacted.
Nice. Yeah. So I think that's a good point, Steve, about mental health and not only substance abuse but mental health. And in our patients in cardiac rehab, they're all subject to in varying capacity and severity, subject to either anxiety, depression, or other problems. And so that's why we administer PHQ-9 and GAD-7 at the beginning of the program. But this is a good thought, actually, of when activity resumes, to screen them again, given the amount of stress they went through, to see where they would fall and recommend appropriate management if needed. So that's a good suggestion.
Emily or Virginia, any thoughts on substance abuse, mental health resources?
This is Emily. I know my staff had to provide some resources to a few of the patients, yes. So it's been a little bit of an issue, not tremendous amount, but yeah, we've seen that.
This is Virginia. I am my staff haven't mentioned it. They haven't brought it up, but it's a great point, and it'll be something I'll be asking them to be adding to their questions when they're talking to people.
Good. So it's certainly something to keep in mind and keep screening for it, and then take care of it as needed. Certainly, like all of us, our patients also have been subjected to quite a bit of stress lately, and so it's part of our mission to continue taking care of that. I see in the chat box here that there is Amanda was asking about, has anyone thought about doing cardiac rehab outdoors or outside? And I presume she meant whether you could do outside your building. And I would say that would depend. We have not pursued that. We have not thought of that very clearly, obviously, but it's something that would require some thought and require whether your telemetry monitoring system would allow you to do that, whether your hospital would allow you to do that in terms of mostly safety and allowing you to do first care if any problem were to happen, whether it would be safe for the patient, and if there were any problem, would you be able to provide first response as quickly and as safely as possible. But I'd be curious to hear if anybody else has engaged into that or been thinking or exploring that option.
This is Emily again. We did seriously think about that because we weren't sure how long it was going to take us to bring patients back. Certainly not every patient would be able to participate in this. We wanted to provide something in the community where we were thinking in a park setting where maybe participants that were further along in cardiac rehab. I thought, gee, do we bring an AED with us? Do we talk to a police officer and see if they would, we're just trying to think of all the possibilities. We were fortunate that we started back up where we didn't need to look into that further, but we did have serious discussions about that, and we're looking at if we could do that as a possibility. I had heard that, I think when I was at AACVPR National Conference, I believe I heard other hospitals have done that before, where they had an outside setting for patients to exercise at. So I'm not sure of all the details, but I have heard of that happening. But I did seriously look at that as an option. You'd have to really consider who would qualify for doing that, and a lot would go into that. But we did look at that pretty seriously.
Very interesting. Yes. So I guess it would depend, as someone said in the chat box, it would depend on your hospital administration, risk management, offices and office to decide how appropriate that would be. But there's certainly another way of being creative and figuring out what would work for you and your patients. Again, I think safety is paramount there in terms of initial response to event, but also in patients, how do they access that space, whether it's safe to do it there, and so on. So as you said, it may not work for everyone, but it certainly could be an option for some. It's interesting you've been thinking about it so seriously. That's very nice. Good. So we're about a few minutes before 1. I think Stephen had some more polling questions for the end, or?
Yeah, we've been encouraging people to think about and to share with us any resources that they wish they had that they don't currently have. And so if you have thoughts on that, just type that into the chat. A number of people have asked questions about accessing the chat comments or questions or getting responses to those, and we are committed to posting those on the COVID page of the Take Heart website, which we showed you a bit earlier in the presentation. And then some of the questions that are coming up for people that are a part of the Take Heart project, there's a discussion list that is addressing some of those questions, and the fact questions that we can quickly track down answers to, we're committed to posting as well. But if you can, tell us any resources or materials that you wish you had under the current circumstances, or as you're preparing to reopen your on-site cardiac activities. Just enter those into the chat so that we can see what those are. As I said earlier, ARC is very interested in and CDC are very interested in knowing where the needs are in the field. Having said that, just if we can move ahead to the next slide, just to make a few wrap-up comments. We thank you again for participating today. The next call is going to be 3 weeks from today on June 4th, where we're going to be talking about the issue of reopening on-site cardiac rehab safely. And many of the chat comments today related to that issue, be it with masking, having things outside, other issues, and we know that it's a very important topic because safety of patients, and for that matter, safety of staff is paramount. So Hicham will be facilitating that call with a few other leaders in the field that will be able to talk about issues, and then we'll want to be responding to your questions as well. So that'll take place 3 weeks from today. You can put it on your calendar, and we'll be sending out registration info on that shortly. You see there the website link where you can go to talk with peers about the issues that have come up on the call today. And you can see the address where the slides from today and the event polling question results will be posted as well. So thanks very much for your participation. I want to thank Hicham and our panelists today for sharing the insights and the things that they're doing in their hospital. And then as we draw to a close, we're very interested in you responding to a couple of questions about the event. We want to continuously improve what we do, and the best way that we can do that is by getting some feedback from you. So as you close out, you'll be asked just 3 very short questions, and we'd very much appreciate your responses to those as well.
Thank you.
Thank you for coming, and unless there are any final comments from Hicham or Cynthia, we will say farewell to everyone, and we look forward to talking with you again on June 4th, 3 weeks from today.
Yes, thank you, Steve. I just want to reiterate our thanks to Emily Keltner from Fort Wayne, Indiana, Virginia Morris from MedStar System in Maryland, and Wendy Johnson from Leesburg, Virginia, as well as Melissa Heineman from Louisville, Kentucky. Thank you guys for sharing your experiences throughout this a variety of topics from orientation to exercise resources and stress and education resources. You've been quite inspiring in what you've been doing. I want to thank the attendance, about over 100 people actually who were, over 120 people actually who were in this call for an hour. So this is very enriching. This was a very enriching discussion. I want to thank everyone and encourage you to continue to remain in contact with us. And I look forward to talking to all of you in about 3 weeks about how we can resume our activities safely. Thank you.